Lovely. Boom. Okay. Just turn you around. Cool. Okay. Guys, I'm going to kick off this live session today just talking about an office setup if you've got a lower back pain and sciatica, something to help you guys, because at the end of the day, when we've got a lower back injury down here in the lower lumbar spine, the act of just sitting in the office, we've got to do it, right? We've got to make a living. We can't just quit our job for 6 months while we get better in the lower back. So we have to do things every day, and working in the office, whether that's at work or whether that's your home office, is going to be a feature that really bothers a lot of people. If you can only sit down for 3 to 5 minutes at a time, that's going to be real trouble if you have to be in the office. So we've got kind of a 3-stage setup to help you guys if you are struggling with lower back pain down here, that's going to help you a little bit with regards to managing in the office a little bit better, so it's not bothering your back as much as it otherwise could be. So step number one, or thing number one, and this does require a little bit of setup, right, is that ideally you want some kind of sit-stand desk, right? Because being sat down all day like this, like that's just not ideal. We're squashing down on those discs in the lower part of the lumbar spine, and that's just creating more compression. Remember, when we're sitting, we're putting 40 to 90% more load through our lumbar spine, no matter how we're sitting, right? We can't sit in a perfect position compared to the standing position. So that's just something that we can't really get around, so we have to do the best we can. And a sit-stand desk can make a world of difference. This here is not a sit-stand desk that you should buy. This is a windy one. And you will notice if you've watched our live streams, how many times it gets put in the standing position. 0. For the first week we had it or so, it got used a lot. Now it doesn't get used a lot. And so if you're gonna buy a sit-stand desk, make sure you buy one that actually you can press a button and you've got your standing and your seating height. It's worth the investment, quite frankly, because using the manual ones is just a waste of time. You may as well have just bought a static desk. So a motorized sit-stand desk, ideally with programmable heights, is going to be an essential. We then want a comfortable chair. Now, I would argue this could be considered a comfortable chair, but for some of you guys, it's not necessarily going to be that good. But you want a comfortable chair that you feel like supports you. You can do little things like putting a small rolled up towel in the lower back to support the lordosis, but you also want this feature, move the barbell out of the way, of being able to rock back on the chair, right? This rocking and being in this position allows me to create less pressure on my lumbar spine. When I'm in the reclined position, more of my weight is going through the chair, through my rib cage, rather than in this position where it's going through my spine. So being able to just sit back a little bit like so, keeping a neutral spine with a towel supporting my lower back can actually really work. So contrary to what some of you guys might have seen, actually having a supportive office chair can be really, really helpful for you guys to provide a little bit more support when you are actually sitting down. Because quite frankly, standing all day is not necessarily an ideal option either, because your legs are going to get super stiff. So when you do eventually rest, you're going to find it uncomfortable because that stiffness that's built up in your legs is going to start to pull on the hip joints, because they aren't mobile. It's going to pull into the lumbar spine and aggravate you when you do eventually sit down. So that's something to really bear in mind from a strategic point of view. So we've got a sit-standing desk and we've got a comfortable chair. Then obviously we've got the standing position, right? So we're going to go up to standing, and in this position our spine is going to be better. Some of you guys might have those fidget mats, where it's a mat with funny kind of surfaces on it and you can kind of put your feet on those. Those are additional options that you can potentially leverage if you so choose. So that's something to consider. Some people like having a walking pad in the desk so they can just do walking while they're doing certain types of work. Now admittedly, that's not necessarily going to work so well depending on what kind of work you're having to do. So that's something to really bear in mind. And then when we go over me 1 second, guys. When we go over to correct microphone on the YouTube channel, and then when we go over to the standing position, we also want to have an opportunity to rest and recover in that standing position, right? And so that's where having quite a high stool chair. Now I talk quite a lot about having like a bar stool, something where instead of being stood up for like 4 or 5 hours straight, you can actually like perch. And that perching just takes a bit of pressure off the legs and allows you to still keep quite an upright position. Now, some of the stool versions like this can actually be quite cool because in this position, I'm above a normal seated position, but you can see my thighs are sloping away from my body. This means I can keep my spine in a more neutral position compared to in the pure sitting position where my legs are up like so. So having this ability to perch, comfortable chair, standing, and perching either via a stool or something like this with a saddle seat, can actually work really, really well as a mix and match. And you can go from one position to the other and rotate that in a way that works for your symptoms. Because at the end of the day, we've got to work. And so finding something that works from an aggravation-free point of view is going to be really, really helpful. If we're doing that, then we can minimize the unnecessary irritation that a day in the office actually has on our lower backs. So we're not aggravating these lower lumbar discs, and that's really important. Now you can take chairs like this. The nice feature about this particular chair is that I can kind of turn it around and I can lean on the front here, which is actually super comfy for your lower back, because now my forearms are taking a little bit of the weight of my spine, and this actually is like, you can even feel like just the pressure come off your spine when you're in this sort of position. But you have to acknowledge that, you know, at the end of the day, people aren't always going to be able to sit in the office like this for extended periods. It might be too informal, it might be too casual for your particular office environment, but you've got to find something that works for you. So the most important thing you can do, if we slide down, when we have a lower back injury, is try and be a little bit fidgety, change positions regularly, because that changes the stress on these tissues down here in the lumbar spine, and that's going to make life an awful lot easier for you in the short to medium term. Because one of the most important things to realize with lower back pain is that there are things that you are going to do every single day that you can't avoid doing. You have to do them, right? You have to go to work, you have to look after the kids, you have to do things. But you want to try and minimize the unnecessary aggravation that comes from those things that aren't good for our back to do, but we have to do anyway, while we're working really, really hard on actually rebuilding strength, resilience, and health back into the lumbar spine. So I'll just go over to onto TikTok, just see if there's any questions that have come through. And then guys, if you're watching this on YouTube, if you're watching this on TikTok, you guys have any questions, any comments, you can always post them down in the comment section, and I'll go through some of those to help you guys with your lower back pain and your sciatica. So what have we got in here? Oh, a bunch of questions come through. I've got sciatic pain at the top of my right leg, but I've started getting nerve pain on my thigh. It's very, very common for people to start out with some element of back pain, and then they have recurrent episodes of back pain. Maybe it's in the buttocks, maybe it's down here a little bit, and then they have what it feels like worsening episodes, and then all of a sudden, boom, they have one episode and it's going down the leg a little bit more, and a little bit more, and a little bit more. And these are classic worsening cases. Now, one of the things that you notice with sciatica, not in everybody, but in many, is that when we start doing the right sort of rehab, this is for good vibes only, Tracy, when we start doing the right sort of rehab, you'll find that generally speaking, maybe about 60 to 70% of cases, that those symptoms then start to recede back up to the back, and then they go in the back. Not all, in some cases, they just kind of settle in their own sort of location, but that is something to watch out for in a good way, and it's called the centralisation kind of process that often is there with sciatica. And if you look at it in reverse, it's a case of most people have started out with back pain, stroke buttock pain, stroke, you know, down in here, and then it's progressed on with successive episodes or worsening. You just got to do the rehab work to start to reverse that process, because it's an injury in here that is at the root cause of the problem. Just scrolling through some of the other questions. There is a lot of stuff going on over here in TikTok. Wait, so you mean for good posture, we don't need to be right in the back of the chair? So that's an important one, Light. So one of the things with sitting is if you're sitting in a comfortable chair, so that office chair example that I mentioned, you want to have support for the lumbar spine, because the idea is that it's a comfortable, supported position. You've got a little towel in the lower back here supporting the natural lordosis. Right? So I'm sat in the chair. This is not an example of the office chair I'm talking about. I'm talking about a more robust one, right? And you're sat back and relaxed. But when we're perching, we're not sat really leaning on anything. This is the disadvantage, right? Because if you're sitting in the perched position, obviously with the chair higher, and I'm in this sort of position here, I've got to be very active and engaged, which means I get tired. So one of the things that people often find is when they start working on their back, start working to recover from lower back pain down here, because they're being more active with them holding their own body more effectively, which is a good thing, they realize that, gosh, this area of the back is stiff. And sometimes people think, oh, is it referring up to my back? It's like, no, you're just using your body more effectively. So you're actually bracing this area and using muscles that you haven't been using effectively for a while, and they're fatiguing, they're getting tired, which is why you've got some discomfort. Sometimes it feels like burning, right? The same kind of burning that you might get in your shoulder if you just do small circles. I always remember as a boy playing football, we used to do this horrible drill where we just stand there and just do small circles for ages, and your shoulders would burn. They burn. And that's the same kind of burning fatigue from these muscles when you're trying to hold yourself up, which is why that three-step office setup was a three-step office setup with a chair, to sit and relax in, because you want to have the opportunity to take those muscles off strain, because they're going to fatigue relatively quickly because you're probably not using them and haven't conditioned them very well in the first instance. So yeah, good question. It's a mix, right? Some supported work, but some posture, some holding your own posture, and gradually you'll get better and stronger and more conditioned to do that. Samuel's posted on YouTube here, when working on hip hinges, should I prioritize weight over range first? Thank you for everything. I was meant to say, well, thanks. Nice comment. Thank you, Samuel. Very, very good question. You have to make it tailored to you. And this is the great thing, right? Because people always ask, how do I make my back rehab? I need something tailored to me specifically. It's like, yeah, you do, but you don't need different exercises. This is an exact example of what we talk about in the program with regards to tailoring your rehab to you. Samuel needs to ask himself the question, what is your current competent range of motion, right? So as example, let's just say a good or normal or healthy range of motion on a hip hinge might be that we can get it more than I am, right? I have a limitation of range of motion. Right? If I could get myself over more, I've got maybe room to get what we might say maybe 25 to 30% more range on my particular hip hinge. Now Samuel might be stuck here, so maybe he's got 50, 60% more range of room for improvement in the range of motion of the hip hinge. So that's one thing, that's flexibility, right? What's the load? Well, I can hip hinge effortlessly. I haven't tested recently because of my knee, but I can hip hinge effortlessly. I know I did 90 kilos a couple of weeks ago with a torn meniscus for 10 reps, 5 sets, because I was filming some of the phase 4 stuff for you guys. So I know I can do that at the very least, right? I could probably do a good bit more. So for me, I've reached an appropriate level. We talk about 100% spinal loading being the long-term target, not that you guys need to do that now. So I really need to work a bit more on my flexibility, which is something that I'm working on. But for Samuel, he might be only using 10 kilos. Right, for his hip hinges right now. So although he's got room for maybe 50% more improvement in his depth, he's got room for like 400, 500, 600, 700% improvement in his load bearing capacity because he's only doing 10 kilos and he weighs 80. And so that's what we mean by tailoring it to the individual. You get a lot of more flexible individuals who have reasonably good range of motion. They're going lower than I was, but they're doing it with a 5 kilo weight. So that individual, what are they lacking more? Well, they've got appropriate levels of flexibility. We can evaluate flexibility very effectively, and often the most flexible are the ones that say they feel the most tight, which is a thing that maybe I'll go down that can of worms or that rabbit hole if it's appropriate. But Samuel, it really depends on what your current level of loading is versus that flexibility, and what room for improvement have you got in each of those parameters. The flexibility is pretty easy to identify when you've hit an appropriate level of flexibility on the hip hinge in terms of range of motion. And I would suggest that probably, unless you're doing 60, 70, 80, 90 kilos for 10 reps of aggravation-free reps of hip hinge, then you're probably, your main area of improvement is going to be the load-bearing capacity, because it's load-bearing capacity that's going to be tested every single day. And that's the thing that we need to improve, because that creates that robustness and that resilience. Then we can start considering the need and the merit of working more explicitly and in a focused manner on significantly increasing our range of motion. Gradually though, the reality is that as you're working through and as you're getting more and more competent, if you're really being thoughtful, as you get to the later stages in the recovery process for your back, you're not going to be able to do quote unquote max spinal loading every session. And so you'll have what we call recovery sessions in there. And this is something we've talked a lot about in the new iteration of the program. Which is really, really important, right? Recovery sessions. And in those recovery sessions, you might have done your max loading on Monday, and then on Tuesday and Wednesday, you're doing significantly less loading, but you might work a little bit more on the range of motion as a mechanism for active recovery. Well, that would work really nicely. That way we're getting a little bit of a blend of both, but don't worry about slowly improving the range of motion. Because also, if you're still suffering with symptoms, then the range of motion is constantly going to be beset with irritations and aggravations of the lower back. So working on flexibility in the early stages of the recovery process is a waste of time. It really is. Now, we still do some flexibility work that we talk about in the back pain relief stuff, in the relief work within the program, but we have to not be under false expectations that that's actually cumulative in any meaningful way. However, that exact same flexibility work that we're doing in the early stages of recovery can start to have improvements in the latter stages, because some of the factors that have prevented us getting better have been mitigated by way of increasing strength and resilience in this lower back, so it's not being flared up every single day. So, well, we've got a lot of comments coming in on TikTok, so I'll come over here. Thank you, Samuel, thank you. And guys, if you find these live sessions helpful, we are going to be doing them a little bit more reliably and frequently, probably 2 to 3 times a week. So please do consider sharing the channel or whatever with people that you know might benefit from these, because it makes it more fun. It's fun getting these questions. It's nice, it's educational, and hopefully it's helping a lot of you guys, get the support you need with your back. We've said here, lost that one. Can thoracic herniated disc heal by itself, caused by a car accident? Everything in your body is trying to heal by itself. You don't actively heal, as in, it's not something like think, heal, heal, heal. Any injury, your body is naturally going to try and go through a healing process. When it comes to spinal injuries specifically, whether it's in the thoracic spine, the neck, the lower back, the biggest barrier, specifically with the lower back though, because it's under so much more strain relative to other areas of the body, is that so much of what you do every single day is interfering with that recovery process. And this is such a significant component that people say, oh, well, the backs don't heal. It's like they do heal, the tissues do heal. They just have a lot of barriers to recovery. So we need to be more strategic. We need to be educated around how these little discs, these little segments of the spine are actually under quite a bit of stress, and we need to create an opportunity for healing. We need to create a safety net around that area. And in the individual that quite frankly can't lie on the floor and wiggle their leg without their back moving all over the place, well, they're not setting themselves up for success, which is why learning rehabilitation work to stabilize this section of the spine immediately is the way forwards. It allows you to provide that safety so that you're not constantly re-aggravating the injuries that are at the root cause of your back pain, whatever section it's in specifically. What stretch is good for spondylitis lamina? Same muscles. Yes, stretching does work. Like, for example, if you take the uninjured individual and constantly stretch their hamstrings, they will make improvements in their flexibility. But the problem is you guys have injured this section down here in the lumbar spine. So you stretch your hamstrings out and then you irritate your L5S1 or L45, which sends signals back out to those hamstrings to tell them to tighten up. So you lose the gains that you've made. So that's why stretching, we're not saying stretching doesn't work. Stretching very clearly works, and stretching is something that is included. But you have to appreciate that stretching is going to have limited benefit when the cause of that tightness, that significant tightness that many of you will experience, goes unchecked. Other questions we've got here. Got a couple of duplications there. It's sick that there is no good surgery for this, like ACL tears. The thing is, with an ACL tear, you've got a second knee. You can lean on the second knee while the other knee is undergoing its rehabilitation process. You've got good control over the knee. You can see the knee. You can see, I've got to protect this guy. You can't see the back. And so I don't think necessarily that it's that the surgery fundamentally is inferior compared to maybe other areas, but it's the circumstances that the lower back exists within the real world that I think makes back surgery specifically, and back injury recovery by extension, more difficult, because you don't have a second one to lean on, to lighten the load. Like, you see how much muscle wasting you will have if you have a knee injury, how much muscle wasting happens on the quad by virtue of not using it. That level of muscle wasting in someone that has poor control anyway over the lumbar spine is catastrophic for the stability of the lumbar spine. So it's just a more complicated injury, even though the injury itself is not more complicated, but the circumstances for recovery are more complicated in the lower back, not least of all because you can't see the thing. So it's not really real to so many people. And that's why we talk about thinking about it like a surface wound, because it helps you understand. Savage has said here, what about loss of disc height? Loss of disc height can vary, right? Is it a little bit of loss or is it significant loss? Either or doesn't make too much difference. Now, if it's significant disc loss over a short period of time, we're talking about a substantial disc herniation down in the lower lumbar spine, well, that can create quite a little bit of instability, because we've gone from a height that might be like that to more or less no height at all, or rather a height that might have been like that to more or less no height at all. That's going to seriously change the integrity of the stabilizing structures in that lumbar spine. And so often you'll be given things like knee hugs and child's pose and twisting and bending to further reinforce that instability. Just think about it like this. And have I got a band around here somewhere? Yes, we've got a band. Awesome. We have in our lumbar spine 2 bones that are separated, right, apart from one another. And so when these two bones are separated apart from one another with an appropriately heighted disc, there's tons of other ligaments that run between this segment to create a natural tension between the two segments. This is a very, very important. Hopefully this example makes sense to you guys. And so that is, for example, if you think my thigh bone is the lower bone, right? It's the lower disc. And my arm here is going to be the upper vertebra. So maybe my thigh is L4, okay? Is L5, and this is L4 vertebra. And I've got a nice big disc in here. You can see the band is tense. Let me move this out of the way here. Okay? When my disc height drops substantially, now I've got no tension, especially if it's a quick all of a sudden, right? I've got no tension. So I've got a lot more freedom of movement because everything's loose and floppy. And it takes time for these ligaments to remodel and restore their tension so they've got tension again and provide stability, which is why so frequently you see the presence of things like minor spondylo or retrolistheses. Those are forwards and backwards shearings. You've got a massive drop, which makes all of those ligaments go loose fundamentally because they were running from A to B and now they're running from A to B. And that instability there is then made worse by the sheer misguidedness of being prescribed knee hugs and child's pose to further stretch the thing out, rather than giving it what it needs, which is a protection and a stability to that area. Now, granted, the reason this is more of a challenge is because when those two discs, when those two vertebrae move closer together, the hole here where the nerve comes out gets a lot smaller. And so that smallness of that hole creates a problem via the stenosis that is caused, the narrowing of the hole. And that stenosis means that when inflammation fills up around these little nerves, the pressure increases faster. If I pump a bunch of fluid into a cup that's this small, I'm only going to be able to put so much fluid in it before it starts overflowing. And because fluid is non-compressible, it's going to compress the other tissues in there, or it's going to overflow, obviously, in the example of the cup. If the cup is supposed to be this big, and I put this much fluid into it, then it's not going to really create a problem. But in the case of the stenosis, what we find is a minor injury that results in a small degree of inflammation that happens on this side will start to irritate this nerve because the hole is smaller. But if it happens on this side, where there is no hole infringement, then that same amount of inflammation won't fill and create the same amount of pressure in this space. And so that's why most of the symptoms that you guys suffer with, beyond the initial injury itself, between flare-ups, is actually that accumulation of inflammation in these confined spaces that creates irritation in the nerves. Jeff has said, I have 3 bulging discs in the lower back, occasional pain, but a lot of muscle tightness. I can walk without pain, but cannot sit for more than 20 minutes. How can I fix that? Thank you for the amazing work. Thanks, Jeff. Nice question. Fundamentally, we need to do 3 things, but I will, before I go into those 3 things, remember that sitting, you're putting more load on your spine. So we've got injured discs, bulging, right? By bulging, we understand that they have been injured, and if we're experiencing pain from time to time, they evidently are load intolerant. And that's what's happening in the sitting, right? Some people can't sit for 2 minutes. Some people can't sit for 20 minutes. Some people can't sit for half an hour. It varies, right? And that's not really important. It's nice to have the measure, and then you just observe how that measure changes with time. So the 3 things that we need to do. Number 1, we need to have rehab. And rehab teaches us, like I've just been talking about stabilizing this spine, providing stability. So using exercises like we talk about them all the time, the core 5, dead bug, marching bridge, squat, hip hinge, and step up. These are exercises that teach us how to stabilize the spine, but then also are used with varying amounts of weight to steadily rehabilitate and rebuild the load tolerance for those sections of the spine that are injured. It's very likely that those 3 disc bulges are going to be this one, and this one, and this one's probably the worst, or this one. They tend not to be uniform. There tends to be a bit of a ascending in severity as you descend the spine, generally speaking, but not always. So that's something to bear in mind. So our rehab work is essential. That is what is getting you better. That is what is increasing the load tolerance of your lumbar spine and those discs specifically in the medium to long term, once you've done the work to figure out how to perform those exercises correctly, right? And that gives you technical improvement. It means that you're getting up and down out of the chair, you're doing it with more control. You're not doing the classic, oh, there we go, and boom, back down into your back. With the rounded lumbar spine, you're able to actually get up and lower yourself down in a more controlled manner. That literally, like, we get patients in the other room and they're like in excruciating pain. They say, I can't get out of the chair. And literally and this is why it's so annoying, because it's just a quirk, but it's really important, right? It's like, you can fix their back pain getting out of a chair in an instant by just teaching them how to do it in a way that doesn't constantly strain the disc. Now that's a hack to a certain degree, but it's hacking in and teaching them how to actually get up with an engaged core and not keep doing this all the time. Right? That literally can make a night and day difference in a moment. You haven't fixed anything, you've just stopped the person aggravating themselves. And that's the power of learning spine stability exercises, especially those 3, squat, hip hinge and step up, because you're doing them every single day. And so they're teaching you how to do something in a way that's not messing up your back. And if you've got 3 bulging discs, there's probably a chance you've been doing that stuff wrong. So learning it is so powerful. The second thing is relief-based work. Sorry about the sandwich truck, if you guys can hear that. The relief-based work is stuff that you can do on a daily basis to relieve stress and strain. It is not cumulative, it is temporary. It's stuff like decompressing the spine here. It's stuff like keeping the hips nice and mobile as best you can. It's stuff like contrast bathing. I've got the cube here, which is absolutely an awesome tool. Right over the lower back to do hot and cold therapy. Those kind of things that are helpful to do. And then you've got to have education. Because if you don't have the education to tie it all together, and for example, apply what we just discussed, the good squatting form, to your daily life, then you're going to be doing great stuff in your rehab, but you're going to be tripping yourself up outside of the workouts. And that's really important that we don't make that mistake. And guys, like if you need more support, if you are struggling with your back pain, with your sciatica, with your bulging discs, check out the link. I've posted it in the chat on YouTube Live. And obviously there's a link in the profile page on TikTok for you guys over there. Like check out the program, because that's going to be the best way for you to get the rehab, like period. Like there's not going to be anything better than that from a rehabilitation point of view. I'm very, very confident in that because of the amount of work that's gone into it. And just comparing it, like having that ability to have on-demand tutorial videos, troubleshooting videos, support, like all of that stuff makes the world of difference. Like when you compare that to how patients used to come in and see us and how many of you guys will see your professionals, you go and see your physio once a week, once a fortnight, once a month, and you have an hour with them. And some of that is the niceties and pleasantries. And then you got like 20 minutes of focused work, and maybe some of that was treatment. So 20 minutes of like strategy stuff. And then you're expected to remember all of that for the next 2 weeks and not do things wrong. That's where like nowadays people say, oh, well, I want to see someone in person. It's like, yeah, but like, even if you came in to see us in the clinic and we spent an hour and a half together, right? There's only so much wisdom that can be imparted to you that you will remember. Whereas when you've got hundreds of videos, like the brain put down into video form that you can consult with at any point in the day, multiple times a day, that is just so far superior to the old way of getting treatment for back pain and recovery and rehab for back pain. It's just not even funny. Like when you take a step back and actually evaluate it, the kind of support, the kind of level of support you get from those kind of online programs, it makes a world of difference. Because the amount of times, like back in the day when we were in London with the clinic, and you'd go through with a patient, you'd go through, I mean, yeah, we've got it. They come back in next week and you're like, no, we haven't got it, we've forgotten it. You know, we're not doing it right. And so seeing that every single day, and that's why we instruct our members, go through with the live routines, following along with us live. Because what you think you're doing, what you're supposed to be doing, and what you're actually doing are sometimes 3 different exercises. It's really, like, it can be that stark in terms of the difference. Comments over on TikTok. Hopefully that's helpful, Jeff. I'm the same, legs numb, pins and needles, quad, shin and foot, can't walk without pain in the outer thigh. Quite often, guys, we get, and this was, I can't read the name, but a recent comment, you'll know who you are. It's easy to get distracted by the symptoms that you guys experience. And the most important thing that you need to be mindful of from a symptoms point of view, if we've got a lower back injury, is the presence of these emergency symptoms, the cauda equina symptoms, the loss of bladder and bowel control, the saddle anesthesia, that's the numbness in this area of your body. You know, if we've had a significant trauma, if you've fallen off a ladder onto your back and you then have back pain and sciatica, go to the A&E, go to hospital and get seen to and make it aware that you just fell off a 2nd-story building, right? That's important. But if you don't have that and you just have symptoms and a very clear, like, aggravatable lumbar spine, or your sciatica is aggravatable by movements of the lumbar spine and things of the lumbar spine, then, especially if you know you've got the diagnosis of like an L5-S1 disc bulge, don't get caught up in the symptoms. Observe the symptoms, note the symptoms, like acknowledge the symptoms, but work on the rehab. That's the most important thing, because you guys will see from the comments and the lives, like, everybody's got the same kind of section of the spine injured, right? It's L4-5 and L5-S1. That's 90% of you. Sure, some of you guys are going to have maybe L3-4. Some of you guys are going to have other involvement as well, right? Some of you guys might have had the SIJs spoken about, right? It's all the same postcode. It's all the same root injuries. You just have slightly varying symptoms. And that's why it's so confusing for you guys online, because a lot of the hacks and the funny videos that you see are about fixing your sciatica in 35 seconds while drinking a cup of tea. is like some quirky little stretch that's geared towards like the nuances of your specific disc bulge on the left-hand side. So you get into this funny position and you hold it there and then you like sneeze, and then all of a sudden the back pain goes. Like that's just a little hack. No healing has taken place in that 30 seconds that you're doing that little hack, but it might feel better. And so we're talking about doing proper rehab, not funny little tricks to game the system. And that's a really important principle. If you do that right rehab work, then you're going to do well. You really will do well. That's what we need to focus on and acknowledge how the symptoms change over time for the better if we're doing the right rehab work. Chris has said, I herniated a disc a year ago. I will try again. I herniated a disc 3 years ago. I had about 3 flare-ups since, taking me out of action for months each time. Are the flare-ups reherniation of an old injury or maybe just irritation of the old injury? Are they not really fundamentally the same sort of thing? It's very likely that you are re-injuring the same section of the lumbar spine, especially if we haven't really done the right sort of rehabilitation work. If we're doing the same sorts of movements, that rounding of the lower back. Now, we can often get a case of maybe, like in Chris's case, we might have herniated the L5S1, which is this last one, and we might be irritated, and that might have stabilized, right? It might have just laid down a bunch of scar tissue, it doesn't really move so much anymore, and actually it's L45 that's been taking a hammering, and that's the bit that's been being aggravated a little bit more. And that might be what's taking place. Fundamentally, whether it's herniated a little bit, whether it's just been strained, maybe the annular fibers have just been strained a little bit, that matters little. We have to do the rehab work. Because if it's herniated, if it's reherniated, let's just say for by 3 mil or 4 mil or 5 mil, are you going to do anything different to if it's just strained in a minor way? No, you still need to do the rehab. Now we might say, oh, well, if it's only a minor strain, I won't really pay too much attention to it and I'll just carry on doing other stuff. But the answer should be, no matter what's happened, we should be doing the rehab work. And if it's a more severe herniation, well, that doesn't change the rehab work, but it might change the timeframes. But at the same time, you can get individuals, and we've had them in the program, we've had them as patients over the years, and some of you guys might really resonate with this. I'll use 2 examples. Number 1 is the example of the patient who's maybe quite young and has a very minor disc strain. Maybe there's a bit of graying on the MRI, but it's not hardly bulging. But they very clearly have a disc strain at that level because it correlates with all of the symptoms and the aggravation factors in the clinical examination, right? So it's a very, very minor strain to the disc. But they're in excruciating pain. Oh, it hurts, I'm flaring it up all the time, blah, blah, blah. And then you take the opposite. I've talked about this case many times before. The grade 4 spondylolisthesis, the guy that walked into the clinic years ago to see me after having, well, we did his x-ray and then we found out, and he had a grade 4 spondylolisthesis. His lumbar spine was practically falling off his sacrum. It was insane. I was like, wow, go somewhere, like, I'm gonna send you over here to go and see these guys because this is extreme, right? And he had backache, doing a manual job. I just wandered into the clinic, right? I may as well get a checkup because it's been bothering me for a while. So what do both of those people need to do now? In that particular scenario, that's very, very extreme, incredibly rare. And of the thousands and thousands and thousands of patients that have come through over the years, I've never seen another case like that of a grade 4 spondylolisthesis walking in that sort of scenario. It was quite extreme, but we still need to do the rehab. So he might have some extra support from a surgical intervention point of view, or they might, as more likely the case, just say, hey, we'll just leave it alone, but you just need to, be mindful of what's going on there. But he still needs to do the rehab. The person that has the injections still needs to do the rehab. The person that has the minor back pain still needs to do the rehab. Like, that's the great thing about this. Some of you with the more minor strains will move through the rehab really quickly. Some of you with the more major strains, major herniations, will move through the rehab more quickly. That's the severity of the injury, unfortunately, with back pain, doesn't really correlate to this, or it does to a degree, but it's so frequently does not correlate to the severity of the pain that one might be in. And the amount of times people will have, I discussed this a couple of months ago, where the person had a herniation. I had 3 people talking about herniation to their lumbar spine, and they had a re-MRI. And one of them was feeling better, but the herniation showed as being worse. The other one was feeling worse, but the herniation showed as being better. And the third one was a repeat of the first one. It's like, make that make sense. It doesn't, unfortunately, right? Because we don't have to have a good awareness of what's happening inside our spine like this. It's not the same as the sensation and the awareness of what we have for things on our face and our hands. We have very good distinctions of points of contact on our body. And if we have a little cut here, we know about it. If we've got a hair on our eye, we know about it. Whereas with our back, it's very, very general. We don't necessarily have that same specificity. Jeff has said, hi, can you show how to safely get down and get up from the floor? It really depends on your circumstances, right? If you're in the kitchen or if you're in the lounge and you've got a chair next to you, like, one of the best things to do is just taking a knee, because that way I can keep my spine nice and upright and nice and neutral. For some of you, it's going to be squatting down like so, right? this is going to be appropriate. But both of these have the prerequisite of you having strong leg joints, strong leg muscles and good healthy knee and ankle joints. But so many do not have that. And that really plays into back pain. A lot of people with back pain have terrible strength and competence in the muscles of the lower limb, which arguably is why they have the hip problems, they have the knee problems, they have the ankle problems, and they have the back pain, and why they can't get better. The individual that is very conditioned that injures their back, knee, hip, or ankle will get better very quickly because they have a lot of strong structures to lean on while that injury is getting better. And so that's an important point of distinction. You know, ideally, if we're getting onto the floor, I'll try and just move you guys on TikTok so you can see a little bit better. And maybe zoom out a little bit on here so you guys can see too. Like if we're going to get down on the floor, you know, taking the knee, coming down onto your side, and coming down like so, that's going to be a safer position. What's not a good idea is to just kind of like squat down and just back like that, you know, and then getting up like that. That's not going to be a good idea, right? You can do it. I just did it and I rounded my lower back. But if you've got a back injury, you just need to focus on doing what you can and using the resources that are available to you. And that's why we talk, it's not practical because there's so many different circumstances that you could find yourself in. And this is why we talk about principles, because principles you can apply to everything, right? Teach a man to fish versus give him a fish. Giving him a fish is showing you one specific demonstration. Teaching you to fish is saying, try and do it with a neutral spine. Use your hips, ankles, and knees to take the burden so your lower back doesn't have to get into such precarious positions. Try and get onto your side rather than going straight onto your back. Try and use those other joints to compensate, to protect the lower back. That's why we're doing our squats and our hip hinges, to use this to protect this, so that we stop aggravating ourselves on a daily basis as frequently. You know, but a lot of people don't have very good coordination. If we don't have enough, this is the challenge, right? You're in a catch-22, right? Because if you don't have the coordination necessary to lie on your back and do a dead bug like that, and your back's moving all over the place, well, do you even have the coordination to get onto the floor effectively? Not really. We don't have, like, we're not in a very good position, which is why we often say to members that are new to the program, it would be better if you did your floor exercises on the bed, because it mitigates the simple truth that you're not good enough to competently get onto the floor, and the action of getting on the floor is probably aggravating you. You know, that's something to think about and consider. Hopefully it makes sense, Jeff, and others. Curler said, I have had my flare-up at the end of July and still recovering. Do you think turmeric supplement and collagen can help? And we're focusing on the wrong things. Way the wrong things. Way the wrong things. Like, focus on the rehab work. Focus on the doing. Supplementation supplements your hard work on the rehab front and your hard work on diet, lifestyle, and all of those other sorts of things, right? Make sure you're eating a good amount of protein. What are we trying to build here? We're trying to rebuild tissue that is primarily collagen in nature. Just get enough protein on board. If you're not getting enough protein on board on a daily basis, then it's pointless taking an expensive collagen supplement. This is what we say to all members. You should get your nutrition from your diet. If you don't, then get a good diet first and then try and supplement. So I've been taking the collagen for my knee joint and for general health, but I get enough protein every day. Now, if you're getting like next to no protein intake and the diet's rubbish, taking a collagen supplement or a turmeric supplement is a waste of money. You have to focus on actually doing the work and getting your real, whole, healthy foods into your diet to support the healing and recovery process, because we are trying to build stuff when we're recovering. We're not made out of thin air, we're made out of stuff, and most of that stuff is derived from protein of some description, or the amino acids that protein is broken down into. So get that in sufficient quantities first. Someone's asked about creatine. And I do think that creatine, there's a lot of buzz around creatine now, because I think it's like the most studied supplement out there, and it's shown to be incredibly safe. And I do think that if you're doing the rehab work and the strengthening work, I think that makes sense. I think that could be something that could be helpful to add in, certainly before the other stuff, right? Because creatine, I think that would make sense to add in creatine ahead of something like collagen and turmeric. That's not to say those things can't be helpful, but please don't fall into that trap of thinking that this pill is going to fix everything. That's the reason that people struggle for so long with back pain, is this belief that I'm going to take a pill or a supplement or a powder and that's going to fix things. Like, unfortunately, hard work is the way forwards. The great news is you can do hard work and it costs you nothing to do that. other than the time, effort, and energy. But sometimes that's too much of a simple solution for people. And it's like, no, but I need something secret. I need that special secret thing, that new supplement that's got all those things in it that's going to really help fix my back for good. And like, that's not how these things work. So really important. So I think, I take creatine, I take it regularly, routinely. I have been doing so since it really, maybe the last year or so. It's very inexpensive. One of the things that I've been warned about and seen a lot of is, like, you'll see a lot of these companies selling their proprietary blend of creatine, which has no research behind it, fundamentally. Creatine monohydrate, like the simple bog standard form, is incredibly affordable for more or less everybody. So if you're buying creatine for like exorbitant prices because it's got some special formula, you're taking a gamble on that. Just get the basic stuff. That would be the most effective, and it's very, very affordable. The rehabilitation should be through pain for it to work? No. That is a very important question. If you're doing your back pain rehab and you are experiencing pain during specific exercises, you are doing something wrong. Now, let me add a clarification point. Aggravation is a better word, because some of you guys are in pain all the time. And so the natural conclusion, if I say they should be pain-free, is you go, well, I can't do it because I'm in pain all the time. No, that's wrong. You should not have any aggravation of your symptoms. That includes more minor symptoms that don't quote unquote bother you as much. If you've got that numbness in your big toe, it doesn't really bother you, but it's annoying. You start doing the squats and all of a sudden that numbness increases. That is an aggravation of the symptoms. You do not want that happening. That means that you're doing something wrong in here and it is irritating the nerves, giving rise to the sensation of that increased symptom. So when you're doing your exercise, like your squats and your hip hinges, right? They need to be done aggravation-free with correct choreography. You should be recording yourself. You should be watching that recording back and comparing it to a recording or a video of someone doing it correctly. Not with pelvic tucks, not with rounding the lower back, etc., etc., etc. And if you do that, you are always looking for aggravation-free repetitions with correct technique. That is how we rebuild health and resilience into this lower back. It is with aggravation-free reps. We're never pushing through pain. And the reality is, and this is why the rehab work, for those of you with lower back injuries and sciatica, is the safest thing you're going to do every day. I repeat, your rehab work is the safest thing you do every day. But people are like, oh, I'm in too much pain to do my rehab. It's like, were you too much pain to walk the dog? Were you in too much pain to get out of bed? Were you in too much pain to go to the toilet? No, you did all those things. So do your rehab. It's safer. Were you in too much pain to answer the door for the Amazon guy that got that parcel that you've been waiting on? No. So do your rehab. Because if you do it correctly, with correct intention and correct discipline and correct care, then it is the safest thing you can do. One could even make the case that all you should do every day is just your rehab, because any other actions like getting dressed are vastly more complicated and convoluted. Putting your socks on, putting your underwear on, having a shower, all of those things have way more risk than doing careful, controlled rehabilitation exercises. Curler has said, I started to do the rehab core 5 exercises and back pain relief routine. That's great, that's awesome. Start doing that. And if you guys need more help and support, you've always got the membership to the program. And you guys on TikTok, you guys can check out the link in the profile page. You can check out the follow button up here. If you guys need more guidance and more help and more support, and those of you that are watching on YouTube and X, you guys can check out the link in the comments to see that there. Other comments we've got here. Can lower back pain cause strain on the upper back? No. But you being more conscientious of your lower back and standing with better posture can put tension through this region, and you realize that this region is not very conditioned at all, and so it fatigues and you get a bit of burning there, just like burning if you did, like I used the example earlier on the live, where if you're like making small circles with your arm like this, your shoulders are going to burn because they're getting fatigued. Same thing in the middle back here. Jeff has said, can you suggest exercises for weak hips? That's literally fundamentally what the program is. The Back in Shape program could fundamentally be a hip in shape program, because you're doing the squats, you're doing the hip hinges, you're doing the step ups. You've got the single leg hip hinge version as well, which we've added into the new part of the program as an essential, right? These are all muscles, all exercises that are primarily working the hip joint, knee and ankle through a range of motion while stabilizing the spine, right? That's what they are doing. You are strengthening the hip region through the program. You're doing a hip hinge. That is like, you get out your 50, 60 kilos, whatever, oh, this one's 60, right? The hip hinge. If you couldn't do that before, oh, well, I'm strengthening my hips. I'm strengthening my knees, my ankles. I'm strengthening my spine. I'm strengthening my grip. Like that's what the program's doing, right? Jeff, check out the link in the profile page, or check out the link, sorry, you're on YouTube. Check out the link, I'll just post it again here in the chat, right? Learn a little bit more about the program. That's what we do. And that's what we're talking about time and time again. Hopefully that helps. Curler said, I can say I started to feel less stiff since I started to follow your exercises. Like, there will be a transition period, right, Curler? Because when we're learning our exercises, there are different things that happen when we're trying to recover from these back injuries, right? Number one, when you start learning the right sort of spine stability exercise, such as the squat, you're often not very good at them, right? And that's a great sign because it means you've got something you can improve on, right? You do a squat, your back's rounding, you don't really know how to do it, but gradually you get better. And you're only doing a shallow squat to start with. You might get some initial irritation when you start doing those exercises, those rehab exercises, irritating the lower back, because you did it wrong and you need to learn how to do it right. But then you're going to find you start doing it right and it's starting to provide more support, you're aggravating your back less, you feel less stiffness, discomfort, sciatica, whatever it may be. Then you start pushing yourself a little bit more and challenging the muscles more effectively, and then you might notice a little bit of what's called DOMS, delayed onset muscle soreness, which is something you need to learn to manage as you go through the process, because that is a desirable, necessary, but a bit of a challenge for the lower back injury. So you might notice at periods you get a little bit of stiffness, and that's where things like massage guns, etc., lower body stretching, the relief stuff that Curler's mentioned in a previous comment can really help you go through that process of rebuilding strength and resilience. And once you get to the right sort of level, you're literally going to be strengthening these discs again, right? If you can go from a point of not being able to do that 60 kilos on the bar or whatever weight it is appropriate for you, maybe you're only doing 5 because your back symptoms start to flare up when you do 7.5 kilos, and then you build it up to 6, like, tell me you haven't strengthened your spine. The weight is going through your spine in both of those scenarios. 6 months ago when you could only do 5, your spine could not tolerate that. Now it can. You have verifiable evidence that your spine is more conditioned. You haven't like rerouted the load outside of your spine, it's going through the spine. We've got a comment from Tarek. Is there any complications after surgery? All surgery has some element of risk to it, so that should really be discussed with your surgeon. If you're thinking about or have the topic of spinal surgery discussed, then send us a DM, because we have, on TikTok, guys, we have a podcast episode. It's freely available, but send us a DM. We can send you a link to it on spine surgery and some things to think about before, during, and after having that done. Like I said, how is it recommended to let the pain recover temporarily, lying down or sitting? Lying down puts less load through the lumbar spine. For example, using the bed decompression stretch. So lying down would be better than sitting. Sitting is not a good exercise, not a good activity if we've got a lower back injury. It's something to try and limit as best you can. I'm not getting pain during the rehab, but the pain the next day, is it recovering muscles or bad form? So it depends where we are, Moreno. It depends where we are in the recovery process. Because for a lot of people when they're in the early stages, what we call phase 1 and phase 2, trying to recover from this low back pain, it's great that we're doing the exercises and not getting any aggravation of the symptoms in the moment. But quite often in phase 1 and phase 2, in the early stages of recovery, while you're maybe just doing body weight or using a negligible weight, everything else you're doing every day is way more strenuous. So you don't know if actually it was walking the dog and the dog kind of chased after a squirrel and that was what aggravated your back, or if it was the exercise. Well, it wasn't the exercise because that didn't, right? Most of the time, it's maybe the cumulative strain of your entire day that is just a little bit too much. And we always gravitate to saying, oh, it was the exercises, even though they didn't cause any pain in the moment. It's most likely those little things that you're doing every single day that are a bit too much. It could also be a degree of DOMS, right? If you've just pushed the weight up on the load that you're doing for something like the squat or the hip hinge or the step ups, then that could be a factor. If you're getting some glute or thigh muscle or back muscle soreness, that could be a factor. But these are the kind of things and kind of questions that you guys will have as you go through the recovery process. And that's one of the reasons why we have that members area in the Back in Shape program, because that members area helps you guys understand these things. And then you see someone else comment and say, oh, I had that, and this is what happened to me, and this is how it got better. That members area inside the membership to the program is so helpful for these kind of things, to help you guys realize that actually some of these things are normal parts of the process, and you come out the other side, which is really cool. Chris has said on YouTube, I'm bodyweight squatting, watching you now. Feel a slight pull in the back, but no pain. Feels good. If you're feeling a slight pull in the back, Chris, definitely get the tape test. Tape test is a video on the YouTube channel. Just search tape test, you'll find it. and you just basically stick some tape along the spine here and do the squat. You shouldn't feel pulling in your back. Often the pulling is that we're getting a little bit of rounding, right? So we're going down and then we pull, right? The pulling happens at a certain point, right? And that's where we're losing form. So you go to a point where the pulling doesn't happen. So you reduce the range, so you're not going that deep. And then you find that spot and say, okay, that's cool. If it's pulling at a specific point, now it could be that as we get to the bottom of the rep, the hip hinge is better for this. As you get to the bottom of the rep, you feel your hamstrings kick in and your back muscles kick in. They are tight, they are tense. That's how one might describe it. Now you might say that, oh, pulling, actually tense is a good description. And that is just a case of those muscles having to be tight. For example, if I hold my arm here, there is a certain amount of tension on my bicep, but I don't really feel too much, right? It's quite effortless. If I put my water bottle on here, I now all of a sudden become aware of the tension in my bicep. My elbow hasn't moved, but my bicep is having to ramp up its tension to maintain stability at the elbow joint. That could be what we're noticing. But using the tape test helps you validate good form, because we stick the tape along the spine and then you can see, if you've got someone else watching you, you can see the tape actually stretch out and it changes, like the light glistening off it changes, or you just feel it pull off your back, and that tells you did it wrong. So that's a really nice little one, that tape test. Lex has said, after 2 months of doing your exercises, my back is improving, less pain. After 3 months, my back is starting... Oh, excuse me.
Now connected to Michael's phone.
Oh, what an interruption. Anyway, so Lex is saying, after 2 months of doing my exercises, my back has improved, less pain. After 3 months, my back is starting to hurt in everything I do. Sitting, standing, walking, everything I want to do, what should I do? I managed to get the weight up to 6 kilos. Lex, have a look at the other things you're doing every day, and also have a look at what we're doing within the workouts, right? There's additional context there that really needs to be explored. One of the mistakes that people often make is when their back starts to improve, they start doing a bunch of other stuff. And we discussed this. One of the great videos to watch, if you've had this kind of experience, you're making progress and then things start to stall, is we discussed it in the back recovery journey. What often happens is you've brought your life strain down, right, to accommodate this lower back injury. And so your competence of what you can do is very low. Then you start building up your competence, and now all of a sudden daily life gets easier, so your symptoms start to settle down, right? And then what happens is you start doing more of that other stuff. And now all of a sudden, although you're stronger than you were, you start doing loads more extra stuff. And that's that mismatch that catches people out. We discussed this in that podcast episode. Yeah, Chris, you thought I said Alexa. Yeah, he did. Listening always. He's probably still listening, even though it's been muted as well. So hopefully that makes sense, Lex. Definitely look at what you're doing on a daily basis, because that will certainly have a number of clues, and your exercises should not be aggravating you. That's a very important point. Sorry about that, guys. I guess I'm still not quite over that little funny throat I had at the start of the week. Thanks, May, Rhino. Bad posture can make back pains. So how can we fix it, or how can we stand and walk the right way? The sort of exercises that we've discussed here today, like, you'll see a lot of people saying bad posture does not cause back pain, and I think that is true. But posture can be either efficient or inefficient in terms of the multiplication of load on the structure. So for example, if I hold my water bottle here next to me, there's a certain amount of effective loading. If I hold it here, it weighs more, and if I hold it here, it weighs more. If I stand here and hold it, and if I stand here and it comes forwards more, it's got more loading than if I hold it back here, right? You can experience this quite well on a hip hinge. For example, if we do a hip hinge with the weight here, we can feel the loading on our spine. As we lift up and up and up and up, you can literally feel your muscles get tense and tense and tense to deal with that increased load. So while I think it's true that bad posture does not cause back pain, if you have bad posture or certain postures increase mechanical strain through the system just by levers, right? We can't escape levers. And while the individual might have made adaptive changes within their system to that bad posture or that specific posture to make it more efficient for them, when they then have an injury, they have more load going through the system. And therefore that makes it difficult to recover from the injury if they have that subliminal disadvantageous posture. So I think that's the relationship with posture. I think I think people are wrong when they say, oh, bad posture there's no such thing as bad posture and posture doesn't cause back pain. They're being too simplistic. They're not realizing that different postures exert different levels of strain through the system, and some are more efficient than others in terms of the actual load. And yes, that some people can adapt to certain postures and they strengthen up in certain areas, and so that posture is okay for them. But when they become injured, they're then having to deal with more forces, and that I think is just glaringly obvious and worthy of consideration in the pursuit of getting better after a back injury. Omar said, I just went to the gym for the first time in a month and a half. I find the back machine where you sit and move backwards. Get in and do proper rehab work. Using those machines is not helpful. I mean, people use them, but do your simple stuff, right? Do your squats, your hip hinges, your step ups, your marching bridges, your dead bugs. Learn how to stabilize the spine effectively, right? And do things that are true to real life. Like, how often do you sit in your daily life and just do this? Like, I hope not that often, right? But how often do you do this? So go in the gym and practice squats. They've got all of the equipment there. Do it carefully, do it thoughtfully, follow tutorial videos. And that way you will leverage that and that time will be well spent. It's not just like understand, the rehab exercises are not just about strengthening up your back. They're also about the technical improvement in the way in which you move. And that's the thing that's often missed. You can go and do lots of things using lots of really cool pieces of equipment in the gym to strengthen this thing up. But lots of those are not applicable to daily life, so you don't get the spillover benefits. Just a random question. Every time I put my safety shoes on at work, my lower back pain is back. Well, how do you do that? Think about how you do that, right? Coming down, putting them on. It's most likely, get a shoehorn. See if that helps. That might be a good option. It was good now, but just like the first week, what can I do? 7 weeks into a hernia, L5S1, I have a lot of pain, can't walk. I do decompression. I don't know what kind of decompression you're doing. If it might be an IDD therapy table, it might be a DRX 9000 if you're in the US. Those kind of things are helpful, but they are not rehabilitation work. You have to do the strengthening work alongside the rehab. Too many people will make the mistake of thinking that when the pain goes or when their pain subsides, they are healed. That's why your rehab is so important for recovering from back pain long term. The rehab gives you an acid test as to how strong or healed your back actually is. You know that you can either lift 5 kilos or you can't lift 7. Therefore, although you might be feeling better, you'll feel better until you test yourself with 8, and then you're going to be in trouble, right? The chances of you exposing your spine to 8 kilos of load in daily life is very, very high. The chances of you exposing your spine to 80 kilos of load in daily life is substantially less. So if you've built up your conditioning to be able to bear 80 kilos of load, then you're going to find the feeling better actually sticks, because it's highly improbable that you're going to be exposed to more than 80 kilos of load in your daily life. And that's why you should use your rehab work as your gauge as to how healed you are, not how you feel. How you feel, yeah, sure, that's the only thing that really matters to us in our minds, but that's not the best marker by any stretch of imagination as to how healed you are. And you should be continuing your rehab. There are so many people, many of you guys in the comments will have this experience where you kept on thinking you were better and then it flared up again. And if it flared up, not doing a 200 kilo deadlift, if it flared up while you were reaching for the kettle, or it flared up while you're putting your socks on, or it flared up while you were feeding the dog, you didn't have a healthy back. You just re-injured the same old injury that hasn't healed many times before. And that's the mistake that so many people make when they focus on how they feel rather than the actual objective testing of the resilience of their lumbar spine. Like you wouldn't go and take your car to get serviced and not expect them to run tests after they'd fix something, right? Oh, you said we fixed this. How do you know? I did a test and it didn't fail. Okay, great. Like, we replaced your tires and we put the tire monitor in and oh yeah, we can see you've now got enough tread. Like, you have to do measurements, right? And that's important. It's not about how you feel. But unfortunately, how you feel is what motivates you to actually do something about it. But we've got to really get on board mentally with the reality that, like, we want to have some kind of objectivity to this situation. Walking for more than an hour is a waste of your time. Like, walking is a relief-based strategy. You need to be doing the rehab work. Like, go and check out the link in the profile page. That's going to really give you the rehab work that you need to do to get better. Walking is a relief-based strategy. We discussed this on the last live stream at the start, right? Walking is there to relieve the stress and strain. It's there to help manage excess inflammation in this lower back, but it is not getting you better. And if we're walking for an hour, unless we've got so much free time every day, we're probably wasting our time. We should be spending time doing the rehab work. What's the best sport to do? Forget about sports when you've got a back injury. You don't start sports when you've got a back injury. You start rehab when you've got a back injury. And then you get into the sports that you want to do because you fixed your back and you can do whatever you want. That's the most important goal, I would say. This and that said, my sciatica has gotten better, but I still can't sleep well at night. My leg pain is tight. Why? So 2 things, guys. We're going to be wrapping it up shortly because we're just coming across the hour. So if you guys have any more questions, you can post them down and I'll try and go through them reasonably swiftly. People get stuck in this limbo land where enough healing and patchwork has taken place where they're not really aggravating themselves that much during the day. And because they're relatively active, the activity helps, walking, for example, helps prevent inflammation from building up too much in these little spaces where the nerves come out. So they don't feel too much on a daily basis. But it's only when they're still that then inflammation gets a chance to build up because we're not moving anymore. And so this and that, what's happening here is that you're going through a healing process, but you're not actually strong enough, and you've probably not made some of those modifications to your daily life to help protect the lower back more effectively. And so we're getting minor aggravation that's not being symptomatically noticed during the day, but you're feeling it at night when inflammation starts to build up and it's not being drained effectively. And that's just your cue to say, hey, look, we haven't gone far enough with our rehab. Continue to make progress. Have a think about what you're doing in the evening, because often people have their dinner, then they just chill out for hours. And so the inflammation is starting to build up in these little spaces where the nerves come out for maybe from 7 till 11, and then you go to bed at 11 and you can't get comfortable because inflammation is built up because you've not been active. So even just changing around what you do in the evening can make a difference to the degree of discomfort that you have when you go to bed, because you're kind of cleaning out the spaces by doing some element of a little bit of walking around, a little bit of some of the relief work that we talk about a lot with members and on the lives here. And that can help manage the area a little bit better, but you've got to do your rehab work. How long will it take to rehab my back and build my core? It depends entirely on rehab for what, right? Rehab to do what? To potter around the house, maybe a couple of weeks. To do more than that, it depends on what you do around the house, right? To take the dog for a walk, to run around, to do all those sorts of things, maybe a little bit longer. It depends on where your starting point is. Understand that for objective strengthening to take place in muscle tissue, you have to work out, this is just the way in which our biological tissues work, right? You have to work out at the desired intensity, the correct intensity, for a period of weeks for changes to take place. In the case of the tissues of the spine, you have to expose them to those kind of loads for a period of months for changes to take place in terms of strengthening and rehabilitation. So use that as your kind of frame of reference. It takes time, and everybody's starting at a different starting point. Chris said, I first herniated my disc through poor sitting in an office. Sitting is the new smoking. Yeah, it's the duration of sitting. I saw something quite interesting comparing our daily life to sort of traditional ways of living, let's say. And they were making the case for the fact that traditional peoples didn't particularly sit for any less time than us. Well, they did a lot of squatting, right, rather than sitting. But it was the duration of the individual period of sitting that is changed so dramatically. And it was like they sat for 10, 15 minutes, then they get up and do something, and then they go back down, and then they get back and do something and go back down. And I've benefited tremendously from that kind of thing in the work that I've done, because I've never had to really sit for hours and hours every single day for weeks, months, and years on end. Because you have patients coming in, you've got this, that, the other, you're up and down, up and down, up and down. Whereas a lot of people are nowadays just sat for literally 8 hours straight. And that is the problem. So not necessarily, perhaps they were making the case, not necessarily the duration of sitting, amount of sitting each day, but the actual duration of any single bout of sitting was the thing that was a little bit more problematic. Guys, I'm going to wrap that up there. Hopefully you found it helpful. If you guys need more support, definitely keep an eye on what's happening on the website and on the program over the next 2 to 3 days. We are doing a very, very big upgrade to the program. So, if you're struggling with your lower back, if you're struggling with your sciatica, definitely check out the website, backinshapeprogram.com. It's over on the profile page. For you guys watching on TikTok, it's linked down in the chat for those of you that are on YouTube right now. It's going to be what helps you guys get better. Like, if you have been struggling, check out the program. There's hundreds and hundreds of videos there. There's a solid structure that you can follow on, and you've got support from us inside the members area and all of the other resources that are there to help you guys. So if you've been, and also, of course, if you found these live sessions helpful, then please do consider sharing them with others, because we are continuing to do them in the run up to Christmas this year. And hopefully it's some of you guys I can see coming back more regularly. It's awesome. It's nice to see. And thank you for all the questions. Hopefully it's been really helpful for you. Take care, TikTok and YouTube. See you soon. Oh, thanks, Secret Team. You too. You too.